Hello, my name is Ruby, and today I will be talking about vaccine reactions and what to expect. Usually, whenever vaccines are going to be provided for cats or dogs, we talk about the potential reactions that can occur. Especially for small dogs or young puppies. In Banfield protocol, we would offer diphenhydramine injection, which is an antihistamine, and it can help prevent vaccine reaction. And usually it is administered 10 minutes before vaccines are given. Right here I have brochures. This is an example of what Banfield would usually give to clients to talk about the vaccine considerations and education about diphenhydramine. It also has checklists of side effects as well as what to do if the client does notice any type of signs or symptoms of a vaccine reaction. The client education portion of the notes are usually written as so. I would talk about how the client needs to monitor their pet for the next 24 to 72 hours for any facial swelling, vomiting, diarrhea, or lethargy, and weakness of the muscles, because those are some of the indications of a potential vaccine reaction. And if any reaction is noticed, to immediately bring the pet to an emergency clinic or to bring the pet back before office hours are closed. So typically when I talk about vaccines with clients, it depends on the age as well as the species of the animal. So for kittens and puppies, I would talk to the owner about how boosters would start about 8 weeks of age all the way up to about 16 or 17 weeks of age when the rabies is done. For puppies, there is the distemper, bordetella, leptospirosis, and the rabies vaccine that are the core vaccines. And then for cats, the FVRCP and the rabies. Since there are chances of getting sarcoma from the feline leukemia vaccine that is offered about basically one time for clients as an option for indoor cats only. So if the cat has never received the feline leukemia vaccine, we would booster in 3 weeks after the first dose. So usually before the feline leukemia vaccine is done, we would do the feline SNAP test to check for leukemia and AIDS, as well as heartworm disease. And if the SNAP test is negative, then the doctor would go ahead and proceed giving the FELV vaccine. So for both kittens and puppies, as I said before, the reactions are similar, and there is the checklist for the owners to look out for any type of reaction, even if diphenhydramine is given. Benadryl can be administered to the pet, and it is basically 1 milligram per pound that will be recommended. But like always, the doctor would recommend for the owner to call before giving any type of over-the-counter drugs. To calculate diphenhydramine, it is the pounds of the pet, which is the weight, divided by 50. For Banfield, the protocol is to never give more than 1 cc of diphenhydramine. So that is basically it for the vaccines and the client education.